Hello everyone and welcome to today's webinar, The Healthy Campus Framework. My name is Clay and I'm a graduate assistant at IHEC. Today I'm assisting Madison, the Assistant Director of the Illinois Higher Education Center for Alcohol, Other Drug, and Violence Prevention, and I'm very excited to be hosting today's event. Before I hand things over, I have a few housekeeping items to cover about today's webinar and the GoToWebinar platform. For those of you new to using GoToWebinar, you will see the control panel on the right side of your screen. This is where you will find the question box you can type and submit to at the end of the presentation. All attendees will be muted for today's program, but that doesn't mean you still can't participate. Please type your questions into the question box in the control panel. This will allow us to see your questions and we will address them later. So without any further ado, I'd like to introduce today's speakers, Andrea Drott and Nikki Brower.
Hi, everybody. I'll just quickly introduce myself. I'm Andrea Drott. I'm the Associate Director for Student Wellness at Northern Illinois University, and I have been involved with Healthy Campus for going on 3 years.
Good afternoon, everyone. I'm Nikki Brower. I serve as the Director of Health Promotion and Wellness at Illinois State University in Normal. And just like Andrea, we entered into Healthy Campus just about 3 years ago. So the beginning of the new process of developing the new framework. So thanks. It's great to have you here today. I would just like to ask you, while you're listening today, to just kind of think about this framework as fluid and living and breathing. So it's not prescriptive, but it's really a chance for campuses at all levels to be able to move toward being more health promoting. So we'll just go through a few things today. We'll introduce you to the core elements of Healthy Campus. We'll provide you some entry points into the framework and then share some resources and strategies to implement and to help you work toward and maintain a healthier campus. And so while we're doing this, just again, think of this as aspirational framework and a way for you to just, schools can start here, they can grow here, they can thrive here. And so this is going to work for you well into the future. So it's not 1, 2, 3 and we're done, but we're actually moving toward, healthier campuses as just a wave of the future. So how did we inform some of the changes we're going to show you today? Well, we asked. And so we, as a Healthy Campus leadership team, felt that it was really important to reach out to the Healthy Campus Coalition members that had been involved for the last 10, 20 years. And we sent a needs assessment. We also did a focus group at one of the annual meetings, and we basically solicited all sorts of feedback. As you can see that we received about 221 responses for the needs assessment, and consider that 221 schools. So we reached out to the representative in each school, and then they all completed the same form. But one of the things that we were most interested in when we spoke to these campuses was we wanted them to know, how would you modify Healthy Campus? And that's really what we wanted to see, what would work for them, what was working, what wasn't working. And so most of the groups wanted a flexible, tiered accreditation system. They liked the idea of ACHA providing webinars, toolkits, and technical assistance to help educate about Healthy Campus and how to implement the program on their campus. And then some of the schools did raise some concerns about lack of feedback and just some general confusion around Healthy Campus in previous years. And so just with that in mind, that is going to go into this new framework.
So really the purpose of Healthy Campus is to encourage campuses to be healthier, right? Sounds pretty obvious. Previous iterations of Healthy Campus provided benchmark goals, objectives to compare and with actual outcomes that were prescriptive. So we want to reduce alcohol consumption by X% over the next 10 years, was how the Healthy Campus was framed. So if you don't have any understanding or knowledge of the previous versions of Healthy Campus, what we're talking about now is really different, and really wanting to make this accessible to as many campuses and places as we can. So with Healthy Campus, it really is the goal to empower campus communities to improve health and well-being. It is a process of helping campus communities do these three things. So become the foundation, the cornerstone of a campus by striving toward health equity and eliminating health disparities through the application of health services. So really in the functional areas. Then supporting a community that increases academic success, student, faculty, and staff retention, and lifelong learning. So really coming together as a community, and then creating a culture where social and physical environments promote health. And so acknowledging that cultural piece that is more than just the people, it's more than a base level of service, but by getting to that culture of health and wellness. So then the core elements of the Healthy Campus framework really are about allowing institutions of any size and resource level to create your own path forward. So facilitating work based on your campus needs. So if you're already really strong in one area or you know an area you need for improvement, the Healthy Campus framework will be there to support that work. The acknowledgement that institutions of higher education are communities was really important as we were just establishing the new framework. As we've taken some of the research and study and work being done in community areas, especially with the collective impact model. So we're looking at institutions of higher education as communities and influencing community level work. We also acknowledge that this should be for students, faculty, staff, and beyond, including community members outside of your institution directly, but it can start small. It can start with a student focus and then grow from there. And every campus has a place regardless of resource, really is that goal. So whether you're a 2-year public institution, a 4-year public, 4-year private, whatever it is, there's a place for you in the framework, and there's the ability to promote and help promote health and well-being across your campus. So one of the main things we looked at was actually the framework for a comprehensive college health program, which is ascribed through the American College Health Association, and that framework is available to members of the American College Health Association. And the infrastructure pieces of the comprehensive college health framework, comprehensive college health program, are really integral to being able to lay the foundation to do the work of promoting health on a campus. And so if you're familiar with that, or if you're not, this really is, was, as we saw it, the main piece that we needed to meet. If we're gonna base level meet the needs of students, we have some form of that comprehensive college health program. The infrastructure pieces are around what administrative support you have, supportive infrastructure, how to help build the community capacity to influence health and well-being across campus. There's really quite a few areas that are covered in the infrastructure area. And I have a wonderful graphic to share with you to help make that part a little bit clearer. So really, the goal is to lay the foundation, knowing that there's the care and services part of this framework and the administration and management part of this framework, where the administration and management part is that infrastructure level. So this is the graphic that I wanted to share. So that outermost ring are the components of the comprehensive college health program in that infrastructure sphere. So the leadership, the funding, the people, making sure you have qualified workforce, there's marketing, there's facilities, there's involvement, accreditation, assessment, things like that that are in that base level. So then when we moved into the cornerstone level, which Nikki is going to talk a little bit more about. It's about that inner ring of services, making sure those are met next. So those inner ring, the confidentiality piece, health screening, specialty services, mental health services, medical services, more on the care and services side. All right.
Thanks, Andrea. So I'll talk a little bit more about one of our first elements, which is the Cornerstone Campus. And like Andrea said, we draw from the framework for a comprehensive college health program. That really is the foundation of a Cornerstone Campus. And there is some wiggle room in there to actually get that to be implemented. This is also for campuses that are working to establish that framework for a comprehensive college health programs. Different campuses are in different places, and this Healthy Campus framework is really meant to meet folks where they're at. And so this is also going to depend on your resources, your population, your campus health needs, the community resources you can draw upon. But again, we're asking about, are we meeting our students' basic health needs? And if we're not, how can we do that a little bit better? Another element, or I think a component of Cornerstone that's very important, is that here we provide and facilitate access to services with a commitment to integrating prevention, health promotion action, and public health with equal importance to both the physical and mental health services. And so you see that very drawn here in the Cornerstone campus, right? Cornerstone is meant to help campuses develop and build capacity. So on this page, we're going to just steer you towards a few strategies, resources, and ideas for assessment. These are just a few ideas. This is not everything. These are just a few examples. And so for a campus, you might not have certain services, but you're going to create a memorandum of understanding with community resources. You might need to create community resources for mental health providers for your students for long-term care, right? The resources for this area are the Framework for Comprehensive College Health Program through ACHA, Standards of Practice for Health Promotion, the Standards for Student Health Insurance, and then Trans-Inclusive College Health Programs. Assessments might look at a gap analysis to see what you're missing, benchmarking other institutions that are like yours, reaching out to your students and getting their feedback. Sometimes this happens through health advisory boards, your student government, different groups. And then again, scanning your environment for your assets and then your gaps.
So then we build on our Cornerstone communities to the community level of Healthy Campus. So at the community level, campuses will specifically work to establish mechanisms for campus-wide ownership of health and well-being through the collective impact model. So this is where the coalitions start to form, or maybe are forming and being directed in a particular way. There's the one of the big pieces of work at this level is establishing that backbone organization. So in collective impact model, the terms backbone organization and champion are very central to that work. And so the backbone organization enables integrative, multi-sector efforts to advance system level change and must have dedicated capacity. So a backbone organization may be your prevention services. It may be your health promotion or health education office. It may be your actual coalition or group on campus. And those champions often need to be poised and put in a position of leadership that has influence and can create change, as well as sell, if you will, to the campus the idea that health and well-being are important. So the champion is going to be your advocate for the work that you're doing, and the backbone organization is the one leading the work. So in a Healthy Campus at the community level, that work is coming together as a multi-ownership place. Again, we're looking at systems level approaches to impact campus wide. And again, knowing who should be at the table and who is leading you are both really important questions to this level. So then a community campus can target a population, or target population broadens to the entire campus community, including students, staff, and faculty. So as we're considering moving past that cornerstone of students being the primary audience, at community level, we really are hoping to influence faculty, staff, and students, knowing that creating healthy and well faculty and staff helps influence our students' ability to be healthy and well. So though the community level really is focused on bringing that next piece to the table. So then some of the strategies, resources assessment for this level are figuring out who the backbone organization is, really helpful. Also acknowledging that sometimes this might be, again, on a specific topic to start. It may not be health and well-being, big picture. It may be reducing alcohol risk on campus, reducing cannabis use on campus. Maybe it's your sexual health or your sexual violence prevention network that's impacting campus to do this work. And those are all valid ways of moving through the Healthy Campus framework and utilizing those organizations that you already have in place. Again, that's that last bullet about that specific well-being concern. So some of the resources you may be utilizing at this level, the CAS standards have a really good benchmarking tool to say where you might need improvement or what might need more attention. The collective impact model is really important here, as well as the Okanagan Charter as the U.S. Health Promoting Network or Network of Health Promoting Schools has been coming together in the U.S. To start sign-on options for the Okanagan Charter. Looking at that document and working through that document to become a health promoting campus can be a really good resource and a starting place for some of this work. And then the assessments, again, doing that population level surveying. So whether that's NCHA, maybe it's CORE, HMS, other kinds of population level surveys. The environmental scans that were mentioned in the cornerstone level, as well as the MAP-IT framework, which is a way to create your own objectives. So while the official objectives were removed during the creation of this framework from previous iterations of Healthy Campus, the ability and the desire to make assessment and objectives is still important so that you can acknowledge where you're at and what your school or institution wants to improve on. Then we have our Culture Campus.
Thanks, Andrea. So we're coming to our third element, the Culture Campus. And I know that a lot of us talk about a culture of well-being, a culture of health and wellness. And so this is really where things are pulled together and they're moving and they continue to move. So your campus is well established in its structure. It articulates steps for its needs. It collectively addresses needs and issues around the whole community. And so your group, your coalition, your well-being initiative group, they're working through a common agenda and shared measurements, right? So everybody's coming together. And the beauty of this is that you can have people from all over campus doing well-being work through the lenses of their own disciplines. That's really what we hope here, right? We're asking in campus culture, are our health and well-being initiatives making an impact on student success and community well-being, including your faculty and staff? And I think the hallmark or the sign that you're kind of there is in a culture campus, regardless of who leaves, a culture campus continues its momentum and its operation towards that common agenda. And it effectively pulls in folks not only from across campus, but into your community. So sometimes you'll be working with a wellness coalition in your community. And like here at Illinois State and in Normal, we have a community coalition around alcohol and underage substance use. And so that's where these groups are connecting to you. And so we see these, and I'm sure I'm not getting to all of them, but the Culture Campus is thriving, and it is moving forward, right? And your measurements are in place, your initiatives, right? Everybody's on board here, right? It's engaged, and that's really what we want in the Culture Campus. We also move to that extending into the community, but also we're looking at environment, the built environment of your campus and the surrounding community, and taking those factors into account when we're establishing initiatives, policy, and so on. Let me get you to the next one. We'll show you some resources. So we're really looking to embed health and well-being into all the aspects of campus culture. That's policy, that's our rules everywhere, in departments, in our student groups, right? Our presidents, everybody, right? We're leading health promotion action and collaboration locally and globally. Strong partnerships that align with the academic mission and vision, right? And our policies on our campus, they're aligned with our values. Resources heavily weigh on the Okanagan Charter, collective impact framework and model, socioecological model. Those are probably the three main resources that help to inform and continue the movement and the work around your Culture Campus. Assessments are shared, right? And those are determined by that well-being coalition, right? The group comes up with that together. You might have a campus health report card or a dashboard, a campus health map, right? You're probably looking at several years of your National College Health Association data and your National Faculty Staff Health Association data, right? You're looking at years of those data to inform health and well-being initiatives on your campus.
So as a general recap of the actual Healthy Campus Framework, we have the Healthy Campus Framework, which I have a link to, which I'll make sure you can get to. It includes a glossary, so talking about all of the terms and things that we've talked about, defining the backbone organization, your champion, even each of the layers, what a cornerstone campus looks like, culture, community campuses, and all of that. And so the Healthy Campus Framework really is providing a roadmap, but not the route to achieving a campus culture that values health and well-being as central to the success of students. So we know students who are well will do well. And by creating that culture, we hope that it's integral parts of the equation that become a whole community that is well and thriving. The Healthy Campus Connect network offered through American College Health Association has the ability to connect with colleagues, share that information, share that connection, and move through that. So feel free to check out the Healthy Campus Connect network. It'll be a repository for resources as well as more information. We also will be launching our Healthy Campus Inventory, which will have different layers to it, but essentially it'll be a tool to help you and your community come together. And I'm going to talk a little bit more about that on the next slide, to actually evaluate where you are in this process and how you might be achieving or not achieving, where you may have some gaps. And then the Healthy Campus website, again, is another place of repository for tools and resources. We acknowledge that it is not 100% up to date as of this moment, but will be within the next month or so. So continue to keep an eye on the Healthy Campus website as we move forward. So then, introducing the Healthy Campus inventory has been a significant part of the work that we've been doing as a coalition over the last 2 years to help evaluate what assets and capacity you have in all areas of health and well-being on your campus. And so it's going to involve many reviewers, so we have some examples up there, but it may be leadership up the line, leadership down the line, having some students to help review where you're at on your campus. And it may also show where some gaps in communication might be. So if your student doesn't know if you have mental health services on campus, then probably that's not, even though it's offered, there may be some other need there, right? So looking at the inventory as a whole, and then providing areas for improvements and next steps is the goal. So figuring out where your baseline is and maybe some areas for growth and improvement to getting closer to that culture of health and well-being. There will be a paid option for in-depth feedback for folks if they're interested in taking the inventory and getting direct feedback from ACHA on the work that their campus could be doing or how they're doing overall. So we don't have all the details of the paid options yet, but there will be some pieces of that, as well as membership versus free options. If you aren't a member of ACHA, there will still be access to many of these resources. It'll just maybe be slightly pared down compared to if you are a member or an institutional member of ACHA.
It's similar to the consulting that ACHA provides, but it'll be in alignment with the Healthy Campus framework. Something I also wanted to share about the Healthy Campus inventory is that we've been piloting this inventory for what feels like 2 years, but maybe I'm wrong about that, Andrea. I don't know if you remember when we started. And so we have been getting feedback along the way from all kinds of schools that have been taking the inventory, pulling their colleagues in across campus to have these conversations. And it's just really interesting how colleagues see things like infrastructure, cornerstone, community culture very differently. But that's exactly why we need everyone at the table, because of those lenses that we bring in. And if anything, everybody learns a lot about the institution and the assets that you have. And so we've been just doing that along the way, and we still have some schools piloting now. So as we make these shifts and changes, they've been letting us know feedback. And so that's been invaluable to this process.
And we wanted to acknowledge, as the Healthy Campus Coalition, that this work is happening in lots of places. So there's the Healthier America, there's the 20 by 30 efforts, there's all of these things going on, and we don't want to compete, we just want to support and help. And so the real goal was to provide some framework for institutions to support the other work that they might be involved in, or provide a lens to help leadership and others acknowledge what might be needed on your campus. Because sometimes in health promotion or health education spaces, we don't always have all the pull or all the pieces to make it happen. But by having a framework and a piece that says, hey, this is the work that's happening nationally, this is the stuff that we could be doing, and then there's options for badging and some other kinds of things that we'll be launching moving forward, that those might be the incentive to get more people to the table. So the last part of the information that we wanted to share was really some practical stuff of where you might see yourself or how you might choose to engage in the Healthy Campus framework. And so we've got a couple of questions, and I know that some of that participation piece can be challenging since you all can't just likely unmute yourselves. But if you can share in the chat some of the answers or thoughts to these questions as we move through these, we'll also talk about some of how we might do that or what our schools are looking at or might be considering.
Will we see the chat?
Huh?
Will we see the chat so that we could maybe answer their questions or share?
No, you will not be able to see the chat. if anyone has any questions or comments that they want to put in, they'll have to type them in, and then I'll be able to read them off to you.
Okay, thanks, because this is sort of conversational.
Yeah, the goal is to be conversational, but that's okay. We know that the limits of the
Yes, we do.
Platform.
And just know that you can reach out to Andrea or myself at any given time, and we are happy to help point you toward resources or just answer some questions. We know that today isn't going to do it all for you. We know that this is just a beginning conversation, an introduction to something that we're so very excited about. And so, yeah, just know any one of our Healthy Campus leadership team members would be happy to do that.
Absolutely. So again, we had a couple of questions. So thinking about first steps in applying the framework, does anybody have any thoughts or perspective as they're looking at this? So I'm going to talk a little bit about NIU and our process. So obviously the framework wasn't set 2 years ago as we were conceiving it in the ACHA office and outside of DC, where a group of us came together and we're having this conversation about the new framework. And we started with the comprehensive college health framework, not a college health program framework for thing. So as I was looking at that, I actually looked at NIU and our meeting or not meeting of those basic health needs. So are we minimally finding the things, doing the things to promote health and wellness, baseline providing service? And found some areas for improvement, found some areas that we're doing really great in, had a lot of questions, wasn't really sure, like, are we doing, is this offered? And through that process, we were also brand new in providing on-campus health service through an outsourced process. So Northwestern Medicine came onto our campus to provide our health service, which still meets all the needs of that comprehensive college health program. So acknowledging it's not NIU offering it, but the need is being met. And so that may be a place. I'm not telling anybody else they should outsource, not the advice I'm giving necessarily. But if you know that you need to meet a need, maybe as a 2-year community college, you don't have your own health service, but do you have a clinic or a place that you can refer students to make sure that they have access, things like that, agreements in the community and such like that to meet the basic needs of students as you go through that. So thinking about first steps, that was ours. Nikki, do you have anything?
Sure. And I think, when we were all working on this together, we were all looking at our campuses and where we might fit and if we were meeting those basic needs. And so Illinois State University is different than Northern. We have a student health services, very comprehensive. We have a student counseling services. We also have community resources. And so we're just a little bit different, but we still have a comprehensive college health program here. We do a little bit of work in the community campus area, right? I wouldn't say we're fully there, but we do some work there, and we're kind of, our well-being initiative is gaining momentum. A little bit in culture too, and I think Andrea would probably agree. We're doing a little bit of work there at Illinois State. That's really what we're working toward. We have embedded well-being goals and objectives into our Educate, Connect, Elevate Illinois State strategic plan and in our student affairs strategic plan. And so you're going to find that you might be, yes, we've made it all the way here to Cornerstone, but there's still movement in the other areas. So just know that campuses are at different places. And that's the beauty of it too, right? We're just all working toward being more health promoting institutions.
Clay, did anything come through the chat?
No, I'm still not seeing anything in the chat just yet.
Great. All right, so then we'll move to our next question. So how do you focus on health promotion efforts in the context of prevention or health education? So knowing that IHEC is primarily prevention services, AOD prevention work focus, really wanted to just have a quick conversation about how does health promotion fit into the context of prevention and health education, knowing that slightly different functions, similar goals. And so just this is an ongoing conversation nationally, I think. So I'm not expecting, brilliant answers today to solve all of our, problems, but I think it was an important piece to bring up as we're considering the work that we're doing in AOD prevention, cannabis prevention, sexual violence, and all of that kind of prevention work, or even sleep health education, or we have our Eat, Sleep, Move campaign, that we want folks to eat well, sleep well, move more, move well, to do those things. But that can relate to the health promotion efforts in a bigger picture. So thinking about that prevention and health education, moving into a community level, moving into the culture level, can you create commonality and collaboration around those topic areas to move that agenda forward? And I think, so again, this is one of the things, as cannabis was becoming legal, right? We had our cannabis task force come together, and we were creating policy. We were informing community. We were doing policy development around the city of DeKalb, and if there were going to be dispensaries allowed and all of that. That's all health promotion work at that level. Even though the topic was cannabis prevention work, how are we having those conversations around health promotion? Even in that little task force, that didn't stick around. It's not something that continued. So I wouldn't say that that was our leveling up into the community level, but our NIU Wellbeing Task Force Steering Committee has come together, which really is doing a lot of that health education or health promotion work in the context of health education and prevention stuff as well. Nikki, anything to add on that?
I don't think so. Just that, we also don't want you to think that these are the answers. We just want you to contemplate these questions, right? How will you focus on health promotion action, right? How will you marry your prevention and health education within health promotion action and beyond? And so we just want you to these are just like, marinating questions for you to ask yourselves and your colleagues, like, where do we want to begin? Right? Have we thought of these things? Because these are some of the basic questions. And I don't know, Clay, is there any comments?
Looks like we have one. It was kind of just as the legalization of marijuana changed, how did that affect education strategies?
Yeah, a lot. I think it's interesting.
Talking about cannabis.
we get to talk about it. So, I think that it's the cannabis work has been really new and different over the last several months, and we are just really focused on providing as much information and programming and education around cannabis and cannabis use as we do with alcohol. So we're transitioning away from using alcohol EDU at NIU and moving into a homegrown program. Homegrown, that's maybe not the right language around cannabis use, but we're making our own program to meet the needs of not just cannabis prevention, alcohol prevention, but also some of those other health promotion and decision-making process information. Spending a lot of time, our goal is to talk about how are you making decisions that align with your values, and knowing all the information that you can to make the best healthy decision for you has been our approach at NIU. I don't know, Nikki, if you have more information on how ISU is tackling cannabis.
Well, I mean, a little bit different, but we're part of, we're an agency involved in a very large SAMHSA grant here in Bloomington Normal. Our Chestnut Health Systems are the PI. And then there's a committee called the BN Parents that works up through high school. And then there's the coalition for the colleges in town where Illinois State University, Illinois Wesleyan, and Heartland Community College are working together to align our work around cannabis. And we're so lucky we get to work with Jason Kilmer. So, every Friday, it's very exciting. But anyway, he's just kind of helping us because, Washington State, they've been legal for over 7 years, and he really has a lot of knowledge around what we should not do. So, and right now he's making a video series for us because a lot of our efforts were just, stopped, due to a pandemic of sorts. So anyway, I don't mean to light of that, but yeah.
Right.
You want me to take the next one, or anything else?
Sure.
Anybody?
No more questions right now.
Mm-hmm. So another question you would ask yourself is, have you identified a backbone organization on your campus, or can you, or have you considered it? Backbone organization draws from the collective impact model. And so, it functions a little bit differently in certain places, but I know in some of the schools, it's an actual department around strategy, measurement, evaluation, and not a lot of health promotion work happens from that place. They're like the center of the collective doing the measurement. So when there's the shared measurements, it's happening in that area, right? And they also communicate across the different departments and entities that are involved in your well-being collective or initiative, trying to facilitate, your wins and things that you want to do, but just the communication of things that are happening all across your campus as far as, moving health and well-being forward. How did that sound? Yeah.
Nice. Well, and so again, for NIU, thinking about the backbone organization, the NIU Wellbeing Collective that we're working towards has leadership from across the institution. And as the associate director for student wellness, I actually have it written into my job description that I will be providing support and ongoing information and effort in the NIU wellbeing sphere. And so by having it in my job description, that it supports that capacity and that work in actually accomplishing some of those goals. I would say our backbone organization right now is that collective. So we have, like I said, folks from our HR, folks from our marketing and communications department, folks from environmental health and safety, student affairs folks, and some academic folks. And as a co-chair of that, so there's 3 co-chairs. We have myself, our chair of the health sciences program, and our director of our employee assistance program. So we're looking at students and faculty and staff and community members and trying to influence all of those areas and acknowledging that the environment is as much a part of that. We've created our strategic plan, acknowledging policy as part of that, health equity as part of that work that needs to be done. And so by having this backbone organization with dedicated resource, even if it's just me for now, helps to validate the work and move the work forward. So really having a dedicated backbone organization can be really important. And when you're moving into creating community, it's essential to getting to that level.
Right, dedicated resources, a budget, Senior leadership supports this fully, right? Remember, somebody on your campus is your champion, and they should be kind of getting everyone excited about this, right? Because we're moving in a way that's going to benefit, right, our campus community. And, you know, that's our students, right? I mean, it's great for all of us too, right? I always say, you know, we want to be healthy for our colleagues on campus, but also for our students who we're growing and nurturing while they're with us. And so we just want to make sure that it, you know, in collective impact, it's very important to dedicate resources to the backbone. And that takes some time. It also takes some, you know, discussion of like, who's going to do what, and are you going to shift here, and you're not going to do this, and that's going to go here. And so it requires some capacity to get it to work. But I think just beginning to consider this and having the conversation is a really good, really positive step in movement towards institutionalizing, because there's really, in Backbone, you're really moving to a system-wide approach, environmental approaches as well, right? Less health education, but more broadly.
And so that leads us wonderfully into the next question of, can you identify a senior leader that can act as a champion in your organization? So NIU had our director of recreation, or recreation and wellness, and he was that champion. He got in front of the president. He was talking to who became our sponsors for the NIU Wellbeing Initiative and all of those things. And he was that leader. He had the energy, the passion, and the connections to be able to have those conversations and sell our work across the campus. But as we move, he left the institution. In July, our student wellness area was reorganized. And so there was a lot of fear that our energy and momentum around this work was going to disappear. But instead, I've navigated with our other co-chairs now that they have more of that champion role, being that they're higher levels in the institution, they have more access to senior leadership and things like that, whereas I may be not as situated to be the champion, but I can definitely support the Backbone organization and do some of that other work. And so thinking about who your champion can be is important, of where they're located in the hierarchical structure, especially if that's part of the culture of your campus.
Yeah, some of the campuses that have these assistant vice presidents of well-being or chief wellness officers, some of those individuals are the champions. Like on our campus, I would say it's probably our vice president, Dr. Levester Johnson. When he came here about 5 years ago, he pulled together the community of practice here, health promotion and wellness, campus recreation, student counseling services, and student health services under his new structure of the division to begin the work of us moving well-being forward. And so we have the support of the entire exec leadership of student affairs and across campus. And so we're kind of doing that a little bit. And so it just might look different wherever you're at, but you want that person to have energy, right? So yeah, and then you support them, right?
Yeah. So anything, Clay, in the chat so far?
Nothing else so far.
All right. So our last question was, are there any barriers that you anticipate? And obviously, depending on your institution, will depend on what barriers you may be experiencing or anticipate experiencing and maybe can work through. Again, I didn't anticipate losing leadership through part of this process, but if that were to happen, do you have a backup? Do you have other people that can fill those roles? Do you have it written into a job description and not just an extra other duty as assigned, so that it ends up falling off or not being included moving forward? So things like that might be important to consider. I don't know, Nikki, if you have other things to add or no.
Sometimes you look at the things that are standing in your way, and then you figure out how to solve them, right? And so sometimes that's how we how we know where to work, right? And so we have to really look at ourselves honestly and decide what's getting in the way. And sometimes there's some low-hanging fruit. I sometimes don't like to say that, but there are some tangible wins, right, for schools that kind of gets folks excited and sees progress, right, which could give you support for more system-wide changes in your organization. And so you could look at it that way, I would say. But I was thinking, as soon as we put up this slide, almost everybody can think of the barriers, right? You know, time, money, you know, my other job, right? So we've heard that from all the folks that spoke to us about the Healthy Campus framework, and then just what, you know, and again, I guess I would just say that, remember, you can start where you're at, right? You can start where you're at. What are a few things, right, over the next couple of years you guys could really focus on? And that could be that framework for a comprehensive college health program, really making sure that all those things are in place.
Absolutely.
Perhaps you don't have a well-being initiative yet or a coalition, right? Right? Perhaps you haven't spoken to your faculty and staff around health and well-being. Pull them in, right? Connect them with you. We do work in both camps at ISU in our office at Health Promotion and Wellness. We serve faculty, staff, and students. And so it really helps us make connections. And you know, we do what we can, but we think it's important that everyone is included in a Healthy Campus initiative. We shouldn't be leaving populations out, right?
Absolutely.
That includes our historically underrepresented populations. How will we pull folks in?
I just want to reiterate some of that low-hanging fruit conversation as we were approaching some of our objectives and initiative for especially this year, acknowledging that the pandemic has put everyone to their limits on what they can and have time for and capacity for, and acknowledging that there was stuff that was happening that falls under well-being as a topic. And so why not put that into our collective measure and celebrate it and support it in a bigger way than just that independent unit doing that work on their own. And so by acknowledging, like, okay, well, yeah, there's a safety compliance calendar now. Okay, is that super, you know, that's not super flashy or anything, and it was one, you know, department's job to get it together, but it has a health and well-being impact on our campus. And so by touting that and acknowledging that and celebrating that as part of the work of this collective, creates that opportunity and momentum, knowing that motivation follows action, right? So like create an action, do a thing, and then find that motivation coming behind it, supporting the work and moving it forward. And so sometimes I just have to take that minute to remind myself, like, you're not going to be motivated until you actually do something. So like, get a small win, share that small win across your campus with your colleagues, with the leadership, and hopefully that will create some motivation to move that work even more. I think that's what we have for today. Anything else you want to add, Nikki, before we close?
Just that, please, you know, take down our names and emails and feel free to reach out. We'd be happy to go into a little bit more of depth or show you some resources, point you towards a few things. Thank you so much for your kind attention. And I don't know, Clay, is there anything in the chat?
Still doesn't look like there's anything in the chat. So yeah, if anyone has any final questions, now would be a great time to go ahead and ask.
We're just really excited to start getting this framework out there. Again, Nikki and I have been involved in the new next generation of Healthy Campus, moving away from the objectives, doing this work for the last several years. And the fact that we're really close to launching everything feels really exciting. And we're really hoping that many campuses and communities can use this and celebrate their wins and make their campuses healthier over time in whatever the most meaningful way is for your school. So this isn't about what NIU is doing or what ISU is doing necessarily. It's about what are you doing and how do you do that work the best that you can for your community.
Right. And how does your campus consider its unique assets or its talents and strengths? What are those unique strengths that are inherent to your institution? And then celebrate them, right? You can look at this broadly, very, very broadly. When you were talking about emergency management, I was like, yes, your campus police, right? Health and well-being, right? Nutrition in the halls, I don't know. So yeah, you know, I can make the case for everyone, right? Because I believe we all influence and impact health and well-being on a campus. So yeah.
Alrighty, thank you to our presenters and thank you for everyone for attending today's webinar. I want to thank our presenters for a wonderful presentation, and to the attendees, please keep an eye out for an email from GoToWebinar that will come about an hour after the program ends. The email will have a link for you to fill out the evaluation. This evaluation will help keep us up with planning future events, and we will get your certificates out to you within 7 to 10 business days. Thank you again.
Thanks, Clay. Thanks, everybody. We'll stick around for I'll stick around for just a few more minutes. Or until the thing ends.